liposuction results in liposuction recovery. You're going to be in a compression garment after your surgery, which is like a pair of Spanx. You're going to be in that for 3 months. 6 weeks, it's around the clock. And then 6 weeks, it's either just during the day or just in. Let's talk about one of my absolute favorite things in the world, liposuction. I've got what's called a liposuction cannula with me. And first, I just want to talk a little bit about types of liposuction and what it is. So liposuction itself has been around for years. So the very, very first liposuction procedure was actually done in the 1920s. It was a dancer who did not like the looks of her legs. The surgeon used a suction device similar to this and decided to suck out some fat from around the legs. This caused excessive bleeding, and she later died as a result of complications from that particular surgery. So not a good start, and it actually didn't gain popularity until much, much later. And as we started to use it more, we learned safe ways to do it, and I'm going to talk a little bit more about that. But there are several different types of liposuction. This is where things can sometimes get tricky, because what happens is somebody comes up with a new marketing buzzword like tickle liposuction or a new trend, and they'll talk about it being the latest and greatest. And when it comes down to it, it's really nothing more than just a basic type of liposuction that's been around for a long, long time. So there are a few very basic types. The first is just what's called SAL, suction assisted lipectomy. And all that is a cannula hooked up to a vacuum. And I literally turn on the vacuum, put this cannula into a tiny little hole in the body, and just start barreling back and forth, suctioning the fat out. That's suction assisted lipectomy. Every form of liposuction actually uses SAL. So everything is built on top of what suction assisted lipectomy is. So the next procedure that you'll see a lot of is called ultrasound assisted lipectomy, or UAL. This has a lot of different names as well. Sometimes it's called Vaser. Vaser is a brand of ultrasound assisted liposuction, and there are other brands that exist as well, but Vaser is the most common one. And what that is, you make your small incision for lipo, and then you use a cannula that looks similar to this, but what it is, it's just an ultrasound wand, and a button will activate the wand, and ultrasound energy will break up the fat. It'll help heat and emulsify the fat, and it makes it so that when the surgeon then goes in with a cannula like this to do suction assisted lipectomy, the fat is kind of melted down, it's easier to collect, and it causes less fatigue for the surgeon, and it can go smoother and quicker. So it's a little more efficient. The results are actually very, very similar between regular old suction assisted lipectomy and ultrasound liposuction. The next step up is laser assisted liposuction, LAL. There were a lot of different devices that were pushing laser liposuction for a long time. There are still some of them out there. And just as you guessed, it's suction assisted liposuction, but now you use a laser, which acts similar to the ultrasound in heating, emulsifying, and breaking up the fat to make the ease of harvest greater. Those are really the three major types of liposuction. Everything else is sort of part of that. The last one that we would talk about is called power assisted lipectomy, PAL. All that means it's suction assisted lipo, but instead of this cannula just being a stagnant kind of stable piece tool, it's connected to a handpiece that will actually help vibrate the cannula very rapidly back and forth like this. And again, what that does, it helps break apart the fat easier, so it's easier for the surgeon to use, and it provides a more efficient tool for collecting fat. All of these things are body contouring for the patient. We're removing fat in areas that we don't want. Some things that have to be present for liposuction to be a good operation for you. You have to have good skin that is not loose, does not have significant stretch marks, is not already sagging due to massive weight loss, because when I suction fat out of one part of your body, the fat I can get out. That's the easy part. What I have to rely on is that your skin has enough elasticity to now contract and tighten where we've removed the fat. Otherwise, you're going to be left with just loose, sagging skin, and we're going to be either disappointed or having to come back and cut that skin out later. So a conversation that I have with a lot of patients is patients come in and they want liposuction and not a tummy tuck because they don't want the scar from a tummy tuck. However, a lot of those patients have loose, sagging skin from pregnancy or weight loss or other things, and I have to have the conversation to tell them the liposuction is is not going to fix the problem. It's going to help debulk things, but at the end of the day, they're going to be left with loose, sagging skin, and they're going to be unhappy. And really, the ultimate right surgery is an actual tummy tuck. Let's see a little bit more about liposuction. We talked about doing it safely, doing it the right way. Safety in liposuction is all about what's called tumescence. We use what's called a super tumescent technique. And what that is that's fluid that we put into the body before performing the suction-assisted lipo. So you remember that first patient who died because of blood loss? That's because they didn't know about or use tumescence at the time. So tumescence is a mixture of fluid, and some surgeons will use different mixtures, but they're all essentially the same. What they are is either saline or lactated ringer, so just fluid, and we put into their numbing medication, usually something like lidocaine or Marcaine. We also put something in there to help squeeze down on the blood vessels to reduce the amount of bleeding that happens. So that's typically epinephrine. Some surgeons will put in something like sodium bicarbonate, which can help with some of the pain associated with liposuction. Some surgeons will use other medications like TXA or Exparel. Again, these are about pain control, blood loss. The tumescence is all about controlling pain, controlling blood loss, and helping kind of separate and make it easier to collect the fat. The procedure, we make a little small incision. It's barely 3 millimeters long. And then we use a small 2 millimeter cannula to infuse that tumescent fluid. Once we've done that, we then perform the liposuction. My preference is a power-assisted liposuction, sometimes with Vaser, sometimes without Vaser. It depends on the case. And then oftentimes I'll use a skin tightening device after the liposuction in conjunction with it to give better results. The device that I prefer is called Renuvion. It's a mixture of radiofrequency energy and helium plasma. We'll do a whole other video talking about skin tightening devices, but that's my preferred option in conjunction with liposuction. Liposuction results in liposuction recovery. You're going to be in a compression garment after your surgery, which is like a pair of Spanx. You're going to be in that for 3 months. 6 weeks, it's around the clock, and then 6 weeks, it's either just during the day or just at night. What that's going to do is that's going to help kind of mold and shape the body the way that we've carved it out by removing fat in certain areas. The other thing that we're going to recommend is lymphatic massage. So lymphatic massage both before and after surgery greatly improves the results of your liposuction. It's going to push the lymphatic fluid into the lymph channels, helping reduce swelling, helping get rid of any lumps or bumps that can be caused from the liposuction. Pain with liposuction is typically gone after the first week. That first week, it can be fairly painful. We do give plenty of pain medication to help control that. But if you think about it, it's a metal stick like this that's getting rammed in and out of you 1,000+ times. So it's going to be bruised, it's going to be swollen, it's going to feel like you've been punched a bunch of times. The first night, one thing that I warn all of my patients about, all of that tumescent fluid that we put in the body tries to find somewhere to go. Some people's lymphatic system is good enough to just pick up and absorb all of that fluid, but most people, it tends to find its way out of the little small incision holes we made, even when we sew them closed. And so I tell patients to put a towel down, wear some clothes they don't care about, think Dexter, it's gonna look sort of like a murder scene. But you're not bleeding to death. It's really just all of the fluid that we put in from the tumescence with the liposuction. Those are kind of my nuts and bolts and basics on liposuction. I do a lot of liposuction, a lot of body contouring. I love it. Come see me anytime and we can talk about options for you.